Alaikum. Good afternoon, everybody. This is the sixth episode overall of live community talks BD. This is a community leaders platform. On behalf of the channel, myself, Habibur Rahman, would like to greet you all. We are very grateful to Almighty Creator Allah, who has given us that opportunity to share you something staying in that COVID-19 situation. It's a very tough situation we are passing through around the world. COVID-19, that is coronavirus, affects on human civilization, affects on economy, affects on education and overall life of the people. Just to share on COVID-19 situation, how we are and how the social worker globally playing their role. We have organized that platform for you just to share the overall things going on in that way. Out of so many limitations, like in Bangladesh last 2 days, our coastal belt people and some other parts of this country are suffering by the sudden hit of cyclone Ampan. There is electricity problem some areas, there is internet problem. After all these things, we are very honored to invite our African friends just to interact with them, to know about their situation, how social work is performing during COVID-19, because all are in a dangerous position. Social worker, of course, they're a frontliner worker like police department, like health doctors, nurses, and so many other volunteers. Social worker are performing a lot. That's why in our global episode, this is basically sixth global episode, but fifth episode for the social work friends. We are very honored to invite our honorable guest today's session. We know the title, grand title of today's session is Stay Home, Stay Healthy During COVID-19, a community social work concern. And today's episode we titled Challenges of COVID-19 and Social Work Intervention, African Region. We are very glad to have our some friends. We have invited Honorable Vice President of SW African Region, and his Regional Vice President and CEO, Chief Executive Officer of Social Workers Association of Zambia, Mr. Josim Kuba Mumba. My friend, welcome to this live show, Josim.
Thank you, and it's a privilege and honor for me to be part of this show, Habiba. So thank you so much, and good morning, listeners and viewers.
All right, very good, my friend. Thank you. We are very honored to invite country lead coordinator, eminent social worker, young social work leader of Good Day, Sierra Leone, Elizabeth Brewer. Elizabeth, how are you? Elizabeth, welcome to our show today.
I'm fine. Good morning, viewers, and good morning, Zambia, and Habibu. Good morning, Sierra Leone, West Africa.
All right. So, dear viewers, there might be some interruptions, some actually problems of network. So, hopefully, you will consider this issue and you will be with us. And today's session will be just 1 hour so far because we are running after so many limitations. So, if you have any comment, you must please put on hurry so that our friends and guests can be communicated. And there are two other guests. They are trying to be connected, but actually still they couldn't be connected. Mr. Jamal Ali Ahmed, senior lecturer in social work, and he is a social worker, State Polytechnic University, Nigeria. Jamal still not in online. He's trying so far. And from Burundi, we invited a social worker, Ms. Kindave Lauren. She is CEO of Smart ID company, but she is a social work practitioner. So, dear viewers, dear friends, globally, our today's episode entitled specifically, especially today's episode, focus on African region, challenges of COVID-19 around the world, and in particular of those countries where from our speakers, our friends and guests invited just to share. and social work intervention. So Elizabeth and Joseph, my friend, we know COVID-19. This is a global pandemic. It hits globally. It creates so many problems around the world. It creates human disaster. It creates a disaster of economy. It creates disaster of financial situation crisis. Overall community disaster is created, and the things that's been created by that COVID-19, it's very related to the way options, potentials, and uses and functions of social work. So there is a huge link that we actually can match with the function, scope, and potentials of social work, and the challenges and the toughness and harshness of COVID-19. Already there are so many friends joined us. I just greet them, and I'm coming back to Brewer. Alamin, one of our friends, say good morning, good afternoon to all of us. Imran Khan, Assalamu alaikum. Walaikum assalam, Imran. Naga Raju from India. Naga, good afternoon to you. I'm Tahir Ali, his professor. You were doing very well, my dear sir. Sanjina Khan, Rumki, good afternoon. Good afternoon to everybody. Jahid Hassan, sir, thanks. Sharmin Akhtar Akhi, assalamu alaikum, sir. Jitendra Kumar Singh, good known to all of you. So we are on the show, and other guests most probably they are trying to connect very soon. I'm coming to Ali Javed. Ali Javed, so far I could observe you have been doing so many works as a young leader. You are lead consultant, you are lead volunteer, team leader of social work, and rather, before coming to your discussion, I would like to just share you something from part of my part. Bangladesh is here. Social work is thought to be more academic, rather practice. But that I could see from your work, you were so many performing works in the field with your set of volunteers. So before coming that, Elizabeth, what is the current situation going on of COVID-19 in your country? Sierra Leone. Actually, what is the existing situation? Could you please share? Elizabeth, could you hear me? Elizabeth, could you hear me? Okay, Elizabeth, could you hear me? Actually, okay, Elizabeth, could you please share COVID-19 situation?
Yeah.
How you are facing?
Good morning, everyone.
Yeah.
I can hear you loud and clear. And yes, I can hear you. Can you hear me?
Yeah, Elizabeth, now you are very clear to me. Just in the outset of the discussion, could you share our audience and viewers in Sierra Leone? What is the situation in COVID and how you are facing COVID situation in your country?
From Sierra Leone,
yeah.
Like you've rightly said, I'm the country lead coordinator for Good Deeds in Sierra Leone, and months since the outbreak of the coronavirus, myself and our country at the moment is quiet on interdistrict lockdown because our country is very small. We only have 2 cities, and which is Freetown and Bowtown, but we are on interdistrict lockdown at the moment. The only challenges we are having as a country is because we are a third world nation, and because we are into a situation where 1% of what we live on comes from international. and flights are not coming in. Things are really difficult. The poor are suffering. If you see on Facebook, since the outbreak, myself and our colleagues have been involved in donating food to needy families, and we've been involved in passing on the message of COVID-19 to people across the country. We have covered so far 35 cities with food supply, and I can't give out of the amount of families who are affected, as good it is really. And we are also complementing the efforts of the government by teaching people the do's and don'ts of COVID-19, because we know the virus cannot spread on its own except someone has it and move around. So that's how we're moving on in Sierra Leone. It's calm, it's quiet, and it's peaceful. Just that we are having lockdown some time to another, and lives. The number of those that are infected, we have had 46 people who have died of COVID-19. So ours is a bit better, more than other places across the world.
All right, Elizabeth, thank you. We will be discussing soon so many things. So now this is initial talks. I'm coming to. There are many friends joined together here. Razia Mukta, Emma Rahman, Aurangzeb Akon. Many of the scholars already joined us. So I'm coming back to my friend Jasim. So how could you explain, Jambia?
Yeah, good morning, everyone. Speaking about Zambia, before I talk about Africa generally, in Zambia, we actually first recorded the 2 COVID cases on the 18th of March 2020. Before then, the government had put in measures in terms of issues to do with social distancing, issues to do with reduced numbers in terms of public gatherings, and also restrictions on non-essential travels. But after we recorded the 2 cases, government has been trying to tighten measures in terms of serious restrictions about travel and also public gatherings. But I should mention that in Zambia we've never had a full lockdown. It's just been partial, people being encouraged to stay home, and also schools and colleges, universities being closed. So currently, as at yesterday, Zambia has actually recorded 866 confirmed COVID cases, and out of that number, we have had 557 we are currently have 557 active cases with 7 deaths and 302 recoveries. So talking about Africa generally, also we've recorded 97,556 cases, that is cumulative. And also we have 55,924 active cases with 3,041 deaths, also 38,601 recoveries. So basically this is the picture that we have in Africa. But then talking about how social workers are being involved in the fight against COVID, I think it's varying in different countries, across Africa. So you have some of the countries that have actually, brought social workers on board and involved them in the response. But then we also have other countries, including mine, where we see that social workers are not really in the front line, but they are doing their routine statutory and non-statutory duties. So basically, this is the picture in terms of Zambia as well as the region. Habib?
Yeah. this is actually scenario. So far I could observe, and I would like to share our friends that you are representing African IFSW as vice president. You are doing so many works there. But globally, there is a buzz, there is a queries and questions actually during this situation, because social work is such a term, is such a word which is known to everybody as charity, as voluntary, because everybody has compassion by nature, right? So it's most of the cases they love to work, and COVID-19 is such a scenario which attach the term compassion, the term sympathy and empathy, though we are advised to stay physically distant, keep solidarity. But matter is, in most of the countries, so many I could communicate, and even in my country, many people are doing social service activities. Many people are helping the poor, right? Many people are helping and standing beside the doctors, nurses, administrators, and the police departments. Those who are contributing as frontliner during COVID-19, but there is a gap in the actions that real social worker, actually those who are supposed to be social worker in practice rather than academic, because social work has you both of you of course agreed on me that social work has two sides equally simultaneously. Those who are academically achieving their practicing field, but in the field the whole country is by name, the people, those who are contributing the society without any academic knowledge, in most of the cases, they are the frontliner social worker because of the absence of us. I'm actually going directly to the topic because time is very limited. We will not get more time for the internet connections and laptop. Those he's operating, it might be off. There is no electricity in that part, so I'm just free, frankly sharing. I would like to come to Elizabeth. Without identification in Bangladesh, in my country, we are fighting for professional recognition of social work, because social work has been taught in Bangladesh from 50th decades. Now, so many universities teaching social work as academic trend, but there is no established social work association functioning. But we are just gradually doing something more to connect social work global platform and also make a platform within the country, because we know social work as an a subject cannot be existed without its practice on the field. So actually, what is the scenario in Sierra Leone? How you are practicing? You are practicing by your own, or there is government affiliation or government helping you through that organization so that you can work for the people in practice field? Elizabeth, please.
Thank you very much, Abibo, and thank you, viewers. Um, yeah, thank you very much, Abibo, and viewers out there. In Sierra Leone, it is a bit different because social work as a started like in the 2000 early years in Sierra Leone, and so because of that reason, our government and Ministry of Social Welfare is looking at a way how they can incorporate social workers into them. But we are gradually growing, are standing up to make a difference in their communities. They have formed an organization, Social Workers Sierra Leone, which I was part of when we started it in college, and now it's an organization that is impacting society, and also have social workers from the university come in and practice. So as an organization, Social Workers Sierra Leone is helping social workers to practice and help impact their communities and help give out what they know how to do best. Of recent, the Deputy Minister of Social Welfare, who is a a certified social worker, has been helping um, the social workers Sierra Leone in terms of practice, in terms of impacting communities and things like that. So for us, the government at the moment, social work practice is new. But to us who have gone through the course in college, it's not new to us. All we are doing at the moment is practicalizing what we've learned, impacting our community, giving back to society, and giving opportunity to young people. Because I remember when we started social work in Sierra Leone, people were saying, I cannot go for that course because nobody knew exactly what it was, how it will affect community, the importance of being a social worker. But I can tell you as of now, a lot of young people are going in to be social workers because they know the impact it will create in society and how they can be able to help young people, old and children, and everyone across the world.
Yeah, right. Thank you. Thank you. We come again, and there are more comments coming. So, dear viewers, those who are with us online, please share it to your more friends so that they can see and comment us. And I would like to come to Mr. Mumba. So, you have a lot of responsibilities, not only within your country, the total region. So, how you are actually working and vibrating to bring up social work as a profession, because without professional identity, volunteerism might be happen, charity might be happen, but professional recognition, institutionalization, and government authority or recognition, it's very tough to reach officially to day to serve for the people, and also create more graduate and freshers for the future. So how could you actually difference this and also share this regarding overall area of Africa?
Yeah, I mean, the challenge is huge in Africa in terms of recognizing social work as a profession. Then what we are trying to do is to try and, mobilize social workers across Africa so that they can come up in form of national associations. And we believe that through national associations, then social workers will be able to use those as platforms to engage governments for recognition. I should mention that, yes, we have quite a number of national associations of social workers in Africa. And out of the number that we have, we only have 3 countries currently that have acts of parliament or the law that regulates, social work practice in Africa. So there is a movement across Africa to ensure that a number of countries can, have legislation that will recognize social work as a profession, and also be able to, practice within, the ethical principles and values of social work. Getting back to the challenges, I think that we are facing, starting from my country and also talking about Africa as a region in terms of social work interventions. I think one of the key challenge is seeing social workers work with limited resources amid COVID-19. And other than that, we also looking at our colleagues, social workers that are working in the governments, particularly like in Zambia, those that are working under the Ministry of Community Development and Social Services. They are required by their functions to, do home visits, to get down to meet their clients. But then with this issue where there are restrictions in terms of movements, where we're talking about physical distancing, it's becoming more and more difficult because you cannot really do a home assessment or conduct home visits online. And when we're talking about doing that online, also we're talking about service users who may have, access to communication devices or internet. So those are some of the key challenges that we're having. And there are also other countries, for instance, Tanzania, where the government actually has recognized the role that social workers could play in responding to COVID-19. And the social workers in Tanzania and many other countries, they've been, invited. They're part and parcel of response team that are out there in the field providing psychosocial support and also making follow-ups in terms of contact tracing for those that have been exposed to coronavirus. But then we also have in other countries where these functions, like offering psychosocial support, are being done by the medical staff. There are some governments that have taken COVID-19 as a medical problem alone and not really looking at the other aspect of the problem, where it requires social workers and social work interventions.
All right, Mumba, there is a question specifically to you. Mr. Alamin loves to know. Good afternoon, Mr. Mumba. Due to this virus, the country's economy is weakening a little bit, and how the economy is controlling and what are the future plans. Actually, he is from Bangladesh, so he loves to know, in particular of your country, actually how your government is working on that, because this time people are thinking during post-COVID situation, because people are not coming out, they cannot work, right? They cannot run their business, education, and country is supporting the people. So how economy can be protected during COVID-19 scenario? Actually, how your country nationally you are thinking, sir, for that?
Yeah, I think COVID-19 has really brought about a lot of challenges economically. In my country, for instance, I think the government has been cautious in terms of trying to put in strict measures. What my government has done is not to declare a full lockdown, meaning that people, whilst observing physical distancing, masking up, they are still going about doing their normal duties. But the biggest challenge has been that most of the flights have been suspended in terms of coming into the country. That obviously impacting on the economy. And also we see that the trade, especially those people that are in the informal sector, their businesses have been impacted by COVID-19 because they cannot bring in things into the country for trade. They cannot take out things out of the country for trade. But I think the government has been quite rational and reasonable in terms of trying to balance between interventions that contain the spread of the coronavirus, as well as trying to ensure that there's still some economic activity happening. So post-COVID-19, I think I've been hearing government saying that we need to learn how to live with the new normal, because it seems that coronavirus is still with us in the few years to come. And so we just need to find a way of living with it, and also ensuring that we manage we manage the economy and ensure things still continue running. But then I think maybe for those countries that had implemented full lockdowns, I think those should be feeling a very serious impact in terms of changes.
Yeah, it's true. Actually, the global scenario more or less is same. It depends and it varies due to the economic difference, right, and financial difference or the status of the country. Actually, it's same so far. So I would like to come to Elizabeth. Elizabeth, there is a great concern on mental health issue really in some countries within the young generations, right? In our country, the young generations is the less portion. They don't like to stay at home. And the number of affected people, especially the age you can say 20 to below 40 is the highest so far. So is there any counseling chamber you open by the social worker association beside the psychiatric, except the hospital, just to keep people online, giving mental counseling or promote mental health? Elizabeth?
Yes, in Sierra Leone, we have a counseling center for young people with who are mentally ill and have a psychiatric. But as it is, like I said, social workers in Sierra Leone have been involved in so many community activities of counseling for mentally ill people. And every Sunday, we call them our friends, we engage them, give them food, And for those whose cases are not really serious, we look out for ways, because we have a platform on Facebook, you've been following me, where we ask our friends in the diaspora to help us so we can help these young their feet, because there are some of them on the streets which are actually not in a state where they cannot get better. They're in a state which all they need is can set this kind of way we cancel them, try to get them out of the street and reunite them with their families. It has not been an easy job, because some people we meet on the street can actually remember us. Like there was a day we were doing the Sunday feeding, and the head for social workers Sierra Leone was fortunate to meet with this guy who was in school, mad on the street, and he was able to recognize him, and he was, do you remember this friend in class? Do you remember this friend in class when we used to run here and there? So for these kind of people, we look at them, engage them to a place where they can be able to be change makers in their society. Because like I said, there are
Right.
some people on the street who are running mad, not because they're sick, but because they are stressed, because society has rejected them, because family has rejected them, and because they themselves have rejected themselves. So we look at all of these issues and try to bridge the gap between them and society, thereby bringing them to their families and restoring them to their community.
Very good. So, Elizabeth, could you add just some points on academic development, rather the practice? Actually, how many universities or colleges or institutes they're producing social work graduates there just to academic development? Just a rough survey that uh, in your country, I
We
mean,
have
Sierra
four,
Leone.
we have four institutions. We have
Four, four institutions. Okay.
institutions that are doing social work as
Mhm.
a program, and we have lots of young people going for it. Every year, we have over 1,000 of young people who graduate from the social work department. So, like I said, the problem we have is government giving space to social workers to practice. But as it is, we as young people are coming on board, having platforms where we give young people to practice as social workers. For example, with Good Deeds Sierra Leone, 90% of us that are in Good Deeds Sierra Leone are social workers. We have in the past, since 2018, when Good Deeds started in Sierra Leone, we have been giving platform opportunity to young people who are graduating from the university to
Very
practice with
good.
us. They volunteer because the issue we have to go to be social workers, but when they come to practice, the passion inside of them is not there to give back to their communities, because what they learned in university is quite different from what is happening in the communities. So when they come into the communities, they find it very difficult to adapt to situations, especially with some communities,
Very
especially with
good.
children with special need. When they come and meet people like that, it's difficult for them to bridge the gap and fit into society. So that is where we come in, giving them the opportunity to practice and belong to their communities.
All right, Elizabeth, let me share something from my side, how we are actually protecting or how we are fighting against COVID-19. Last March 8th March, first COVID positive identified in our country. And till now, the positively affected identified more than 24,000, right? I mean, below 25,000, it's gradually improving. And more than 400 people died. there is a panic situation going on, but nobody loves to. Most of the cases, they don't like to be self-aware in some cases, because by nature we are social being, and in regionally we love to be well interacted, stay together, stay well connected, great, hug, right, and prayer together. So it's a naturalization process, long years, over the years. This is part of our culture. We love to stay together, gossip together, right? In marketplaces, people largely gather together. So last 3 or 4 months, actually, people are not well at all. And COVID-19, as this is invisible enemy, this is unseen enemy, nobody can see and touch. That's why in most of the cases, those people are not highly educated or illiterate. Most of the cases, they think actually they rely on the death or the last judgment of the Almighty, that if I die, I have nothing remaining, I will die. So nothing on me, let's move on together. But nobody thinks in that case that I might be affected, because there are a huge number and percentage of people, they are being affected without any symptom. They have no symptom of COVID-19. They being affected, and they're affecting someone else. The number is multiplying more. In our country, actually, my concern is, that's why I have created that platform. Social work have been taught since 58 decades, more than 8, 9, 10 public universities, 6 to 7 private universities, national universities is producing a huge number of graduates. Academically, social work is in a much better position, but I don't see any specification of job category that social worker can have some chances, which can motivate the young graduates. Those who are getting a degree on social work, they might be motivated and tempted to be a social worker professionally. So such situation do you face in your country and in your region, Mr. Mumba, my friend? So this is a great concern. There are so many questions in previous session, and this question I asked several times in Global Forum. I asked to APASI President, I asked to IFSW President, IASSW President, ICSD President, what you are doing to bring social work in a policy level, so that social worker, the graduates, can be motivated to study social work, to practice social work with dignity. Without self-dignity, how I can produce someone's dignity when I am less motivated, I am less self-determined, I have no hope, how I can show hope somebody else. So Mr. President, African region Vice President, my friend Jassim, so how could you actually, this is a discussion, this is my query, this is my feelings as a social work fellow, that how we could work on this to promote social work, categorizing, creating some space in your country. In your country means my country, I think, because I need global social work expansion. So what is your comments for our audience now, my friend?
Yeah, I mean, that is a very big challenge actually for young social workers, and even for those that want to pursue social work programs in terms of training. Because I think the situation out there does not inspire anyone to social work. But what we are doing in country is we are engaging government to ensure that social work is given space, social work is recognized. And I should mention that currently we are working with government to ensure that the law that will recognize social work and regulate social work practice is passed in Zambia. And we believe that once that happens, then I think social work functions and roles are going to be secure for social workers. I mean, we always give an example, for instance, that when organizations or the government is looking to employ an economist, a social worker will not come forth and say, I'm after this job. But then when it's a social work job that is being advertised, you will see different, disciplines, different professions coming forth. You have economists, you have sociologists, psychologists. Even if, yes, the line, there's a thin line somehow, but then you find that you start competing the same job. But we believe that with creation of social councils in Africa and passing of laws that will be there to recognize social work as a profession, I think that is kind of going to safeguard the job market for social workers. So I think it is an uphill battle, which I think we're still trying to engage in. And also as a region, we're trying to engage different regional bodies, including SADC and AU, to see how at that level these regional bodies can influence the member states, so that they are able to recognize the profession, they are able to recognize and give space to social workers. And also for social workers, this is a challenge also. We need to come to the party, we need to get to the table and demonstrate that we are there to provide solutions, and that society can look up to us in terms of solutions. So basically, I think those are the issues. But the challenge, yes, is everywhere. But then we are progressively working to engage different stakeholders to ensure that social work is given space.
Great, my friend. I'm coming again. Elizabeth, could you hear me? Elizabeth, could you hear me? Elizabeth, could you hear me? All right, Elizabeth, just okay.
Yes.
Okay, actually,
I can hear you loud
globally.
and clear.
Okay, globally, just follow something there. COVID-19 creates so many problems, even so many dimensions of work, so many good things also, I must tell. Because every bad thing, there are some good things. So do you believe we, the social worker, always hunting for some spaces, some options, some workable fields, some scope of work? So Elizabeth, do you match the COVID-19 bad side with the good side of social work in your country, that COVID-19 produces some scopes of practices of social work, Elizabeth? So could you identify some areas in education sector, in just giving people food, support, right? And mental support also. Mentally, people are harassed in all the countries. And especially, Elizabeth, just focus on education, because so far I could guess Bangladesh or in some parts of India, some African countries, not all the countries, we are not actually well established in online platform. COVID gave us that thing, but in rural areas, students are not getting online education facilities, which is on by COVID-19, but still they are in disastrous situations. So Elizabeth, in your country, how students in school level or university level getting support of online education? I mean, what is the existing scenario there in urban and rural part? Elizabeth, dear viewers, actually, last 2 days we have been suffering in Bangladesh and some parts of India due to COVID-19. I mean, of course, this is long time, and Cyclone Ampan, it's hit at us tremendously. So electricity network is not working properly. So many friends, they're just phoning me, just call me that we cannot connect because of the internet facilities here. Even electricity is down there. They cannot get charge their mobile, their laptop. So as we pre-schedule this, we didn't stop this. So please pardon me and our guest. Hopefully they will join again. I will invite them again some days after for a wide, broad discussion. So no worry for that. And I'm coming to Elizabeth. Elizabeth, could you hear me now? Elizabeth, could you hear me?
Yeah.
All right. So could you focus on education
In terms
sector
of
online?
education in Sierra Leone.
Yes, please.
Yes.
So
Yeah.
how it's going on there, online platform based education?
In terms of education in Sierra Leone specifically,
Okay.
yeah, in terms of Sierra Leone, because of
Yes.
our poor internet system, lots of educational institutions are involved in radio teaching programs. And for online, we have institutions that are conducting trainings online. They use Zoom because Zoom is easy to connect, unlike other platforms. So a lot of institutions use Zoom to do their teachings and things like that. But radio teaching has been more effective and more efficient because there are some parts in Sierra Leone where you will not even have a mobile network, let internet. Radio teaching is being done, and a lot of other platforms are using the internet to teach people, more especially with Zoom, because with Facebook Live, for you to have more than 10, 15 people online, it will be difficult. But with Zoom and other platforms like this one we use it, everybody will be able to connect it and learn from each other. So there have been these platforms that people are learning from. Children are benefiting from the radio teaching program because the radio teaching program specifically is going with the school syllabus. So it is helping kids who are in school and those in universities. A lot of universities have recently launched an online training because, like WHO was saying a week ago, that we have to learn to live with COVID-19. Institutions like university programs to get students to be able to learn from online. For Sierra Leone, it is new, not so new, but we are pulling through. The internet is our problem because if you don't have a Wi-Fi and you want to use a mobile data, it's super expensive and not everyone can afford it. But slowly and gradually, we are getting there.
Yeah, it's good. All right, Elizabeth, I will connect you again. I will be with you soon. And I'm coming to Josim, Mr. Mumba. In some parts of African region, what is the summary of online education? Because we are digital country here, digitalized country. Our facilities is so far good. Online system. We are taking classes via Zoom, Facebook Messenger, Viber, and so many other options. We are taking classes, and also a government took any initiative to produce lecture on television, right, here in country, and already communicated. India is doing so, but and some other countries of African regions. What is your comment actually? How they are communicating people? Because this is a great component of creating mental torture, mental illness of the students and their guardian also. Because in urban part, they are getting more facilities than the rural part there in terms of internet and electricity. So actually, what is the summary of that area on online-based education during COVID-19? Is it creating additional mental stress for the students and their guardian there?
I should believe so. I think it is actually creating, additional mental stress for most people. Talking about Zambia, yes, the government has introduced, television education programs for children that are out of school now because schools are being closed. And but again, the issue is that not every family has got access to a television. And then we're talking about other schools that have introduced lessons through Zoom or Google Classroom. And then we also have universities that have also introduced, education programs through Zoom. But I think the biggest challenge is access to internet. Internet data is very expensive, and we are talking about children that are in urban areas, as well as children or students that are in rural areas. So you find already there is a challenge, especially for children that are in rural areas. So, and this is basically the situation in my country, that yes, there are all these efforts to ensure that children and students are kept in the loop of education. But I think the biggest problem is accessibility and to internet. And I think this is a problem that can be generalized within Africa. Yeah.
All right. In our country and in this region, I think I have a close communication with Indian friends regarding expansion of social work, professionalization of social work networking, and field-based social work. So, could you please explain ways and options, process of social work, field work of the graduates, like in Bangladesh, that we follow? Just there are two types of social work field work. One is we are sending graduates when they are completing their BSW, Bachelor of Social Work, graduation. We send to different social work related organizations like hospital, like clinics, even sometimes we are sending some students to industry, right? Mental health hospitals, some psychiatrists. So after this, in masters, we also send them again to work on that field. But these all are so far more or less, most of the cases, not always, I never say this, they are working within this industry or the hospitals, but the sense of expansion or move to the clients at their home, at their residence in the field level is gradually improving. So how you are sending their students, your students and graduates in field? So far I could see some of other friends from Africa, they are doing good work in field levels. Actually, what is the real scenario there, Mr. Momba?
Yeah, in terms of social work training, I think the component of field practicum is very key, and that is also what is being encouraged across the region and within my country. And I think the practice in Zambia has been that for students of Bachelors of Social Work, which is usually a program of 4 years. So what happens is that in the second year, students are required to go for what we call rural placement. So rural placement is where a student is placed with an agency that is working in a rural setting, so that they've got a social practice from the rural perspective. And then once they come back of that placement, they are required to write a report about their experience in the field, and basically that is a requirement for that placement. Then there is another placement which students that are in the final year have to be subjected to, which is called urban placement. So again, under this, you find that students are placed with agencies that are working in an urban setting, so that they've got a feel and appreciation of social work practice from the urban setting. So basically, that is the model in terms of field placements. But I should mention that at bachelor's level in my country, you find that the approach is basically looking at the generic aspect of social work. So it's the generic approach. So we are not very clinical or in terms of micro, but we are more on a macro approach at a BSW level. So you find that students that graduate with a BSW, their focus is more of development oriented, community organization or community development oriented kind of social work intervention. But then at master's level, that's where we see now that there is this micro aspect, micro approach to social work, which is emphasized. Habib?
Just log in.
Yeah. Sure.
All right. Other two friends, they are trying to be connected. Actually, there are some problems. They are trying to online and log in. I just invited them to come in. Thank you, my friend, for wonderful discussion. Actually, in Bangladesh, and frequently I visit India just to see their fieldwork pattern. In Bangladesh, we are in, so far I could explain, in many of the universities, this is block format fieldwork. We produce students and assign students fieldwork during end semester, last semester of BSW and last semester of MSW. But India, I found there are concurrent fieldwork that you mentioned so far, that students are assigned in their second or third semester. In masters, again, they're assigned overall semester so that they can have some community replacement, agency replacement, just to get idea gradually, just to make a link between their academic teaching held in classroom, I mean theoretical teaching, and the field level experiences they can merge together. So it's a experience sharing, wonderful. I think we are thinking so how we can produce students, I mean, concurrent field work, which is really good so far in most of the cases, because student can exchange and utilize and apply their theoretical knowledge then and there in a practice field. That's great, I think. So Elizabeth, could you hear me? Joseph, I'll come again to you. So I'm just going back to Elizabeth. Actually, internet is a problem everywhere. And Elizabeth, you know, my country, Bangladesh, and your country, Sierra Leone, of course, other country, there is a good relation. We are friends of all countries, but Sierra Leone especially has a good connection due to the peace mission, Bangladesh Army. Bangladesh Army doing good work in Sierra Leone peace mission, especially mental health support, development support, right? So Sierra Leone, of course, has a good relation in terms of this and a good feelings for this. So actually, what is going on in Sierra Leone? Fieldwork pattern is same that Mumba mentioned. Mr. Mumba mentioned the same pattern is going on. And another thing is, in our country and some other countries that I could follow, when with a social worker would like to do work, there is two options. In COVID-19, we are thinking, we are listening a word that doctors is here, nurses here, police department is here, administration is here, but where is social worker? But social worker is highly needed just to give them support, mental support, logistics support, ideas, right? Just pushing from back as a catalyst. But social work as professional is not strong, and they are not working in different field due to the categorization, professionalization. So we are feeling a shortage of social work professional support. Beside this, all the departments, those who are standing front line, they are striving and declaring war against COVID-19. Here in our country, social welfare department is very good. They are serving, but social workers not there. We feel shortage. If social worker can stand behind them, the departmental service would be much better, much well coordinated, right? So do you feel in your country, beside the government, social worker is working, or government social service department is working alone? Elizabeth?
Well, I said, system here, social services, which you have in your countries, is something that we don't have here practicing. We only have social workers coming down from the universities and practicing. Like I said, social work is something new not too new, but something new in Sierra Leone. And yes, there is a very good relationship between Sierra Leone and Bangladesh. When we had the civil war, the 10 years long civil war, we had the Bangladesh people come in and help us with the peacekeeping mission. So we have this kind of relationship. And like for Sierra Leone, we're learning a lot, learning from our course, learning from our friends, learning from people across the world. So we are growing and we are getting there gradually.
Okay. Sure. Hi, friend.
Yes.
Around the world, we are striving. Actually, around the world, we are striving to reviving to create a great buzz of social work, so social work can play a very vital role. And my friend Mumba, IFSW has already set some rules, some ethical principle, right? And COVID response measures. So how could you match and utilizing these measures to inform people, to aware people during this COVID-19 pandemic situation, as a regional vice president, how you are coordinating this? Because coordination is a small word, but it bears a great significance. People are saying like this: a great venture may be in vain or unsuccessful because of lack of coordination. So how social worker being coordinated self and coordinating the government? Do you find any options to coordinate to help the government in other countries except your country, and your country also? How you are coordinating with government and also self-coordinating within the organizations?
Yeah, I should mention that I think coordination is very key, and especially now that we have the multi-sectoral response against COVID-19. But I think each country is unique in terms of how that coordination is happening. And we see that, yes, there is the willingness, I think, from social workers and National Association of Social Workers to engage and coordinate with a number of players that are responding against COVID-19. But I think the missing link really is the aspect of recognition of the profession. So you may be wanting to help coordinate the response and also to ensure that social workers are part and parcel of the response. But then if you are not recognized, that becomes a problem. So in terms of the ethical principles and values, I think IFSW provides for a framework or the guideline where we as national associations tap in and also come up with our own tailor-made, a code of ethics as national associations, and we believe that these are supposed to help and guide our practice in our respective countries. But then COVID-19 also brings its own challenges, I think, in terms of ethical dilemmas. I think I had mentioned earlier on one of the vivid ethical dilemma is issues to do with working with limited resources amid COVID-19, because governments are making sure that the resources are going towards the medical aspect of response. And I think the other issue that we're looking at in terms of the ethical challenge is that which requires social workers to meet their clients or the users of social services online, which has not been the case, because if you look at the service users, the majority of them do not have access to online or internet connectivity. And also, I think the biggest challenge also is that which limits social workers to conducting home visits and stuff like that. So that also is creating some ethical dilemma for social workers. But I think with the role that most national associations are playing in terms of coordinating the response and trying as much as possible to engage the government, I think that is quite key.
All right, my friend. In our country and India, there is a great problem we are facing. As COVID-19 started from China, then it hugely affect on European countries, Italy, Spain, right? And then America, UK. Gradually, we were used to learn from WHO and some health department. Then African will be the hot region for COVID-19. And in our region, when it starts from mid of March or end of March, or some countries in Asian starting of March, we were not prepared mentally, right? We were not prepared officially even. There is a big chapter, big question, big area, working people in agriculture and small industries, food peddlers, vegetable producer and peddlers in different areas. Those who are hello, my friend Jamal. Hello.
Hello, sir.
Hello, how are you?
Good morning.
Good morning. Actually, we are mid of the session. We are continuing.
Hi, Jamal.
Your friend Mumbai is here. Elizabeth is here.
Hello. Yes.
Hi, Jamal.
Hello. Good morning.
Good morning. Actually,
Good
all right,
morning.
Jamal. Just my
Yes, are
friend,
you
do
hearing
one
me?
thing. Yeah, one thing. Elizabeth and Mumbai, just mute your microphone so that our sound will be clear. Elizabeth, mute your microphone, Elizabeth. And Jamal, Mr. Jamal, could you hear me?
Mr. Jamal, could you hear me?
Yes, I'm hearing you, but not clearly.
All right.
Hello.
Just yes, please. We could hear
Yes,
you.
please. We could hear you.
Are you hearing me?
Yes.
Yes.
Okay.
So our today's session is on
Today's session is on
challenges of COVID-19
challenges of COVID-19
and scope of social work in
and
African
social
region.
work in African region.
So in Nigeria, in your country, how COVID-19 hits and impacts?
Hello.
Jamal, could you? Jamal, fix your headphone.
Yes.
Okay, just fix it.
The network is too bad here, where I am right now.
All right.
So,
it's clear.
In Nigeria, there are some cases, more especially in big cities like Lagos, Abuja, and Kano, because of the high population. So social workers in these areas are also trying to do their best in seeing that they have tackled the psychosocial problem of such kind of patients, so that they counsel them along, and some little food items were given to the less privileged people in the country, more especially in these affected areas.
So my friend,
Hello?
yes, I can hear you. There are some questions regarding medical social work, how functioning, I mean the medical social worker, how functioning in Nigeria during COVID-19. My friend Jamal, could you hear my voice? Unmute. Mr. Jamal, please unmute your microphone, headphone, unmute. Please unmute your phone. Yeah. I cannot hear you. Jamal, could you hear me? Could you hear me? Internet problem. So could you hear me, my friend Jamal? Could you hear me? Could you hear me? I cannot hear you. All right, I'll connect Jamal later. I'm going back to Mr. Mumba. My friend Joseph Mumba, could you hear me? Please come online.
Yes, I can hear you.
Yeah, internet problem. So Jamal, I will come back again to you. That I was asking you, asking Mr. Jamal that beside academic teaching, practice in different fields, education field, this time during COVID-19, one scope areas of social workers or social work, that is medical social work support, both in hospital, mental support, mental health support, mental healing, and also hospital setting social work support. So my friend Josim, how could you share us actually how medical social worker working there in your country and other parts of your region, and is there really medical social work is well set in that area? Just for sharing for my friends and audience here.
Yeah, in my country, yes, we have medical social workers that are working in a number of hospitals, mainly the hospitals at district level, though that functionality is kind of not very much appreciated, I should mention. But yes, we have medical social workers. But just to mention that, yes, we have also got some colleagues across Africa that are working as medical social workers, and they are actually busy on the front line on shifts responding to COVID-19. So in other countries, I think medical social workers have been really, brought on board to respond to COVID-19. I'm yet to get to know really what the role of medical social workers in my country is amid COVID-19. So actually, I'll be making a call to some of my colleagues who are working in the medical social work field.
Yeah, great. Actually, there are a few comments and more friends join with us. Just I would like to convey their greetings to all of you. Mehrun Labuni wrote, good afternoon, sir. Thank you, Mehrun Labuni. Jahangir Alam Shumon, really, you are doing great job in Bangladesh to improving social work side. It's very helpful platform. MD Alamin, great discussion. Shakti Profa from India wrote, good afternoon, everybody. Badsha Alam Habibudda, it's really nice to see you and thank you. Nure Safed Panna, good afternoon, sir. Jamal Ali Ahmed, already he mentioned here. Peace on to you. I'm online. Rahan Anjum Tanha, Assalamu alaikum, sir. Good afternoon. Hussain, Habib, sir, and all speakers who are there. My greetings. Assalamu alaikum. Sharmin Shithi from Sofer UK. Good afternoon, sir. So, thanks, my friend Jasim. Actually, Jamal, internet connection most probably creating problems. So, could you hear me, Mr. Jamal Ahmed? My friend Jamal, could you hear us? our voice? Actually, huge problem of internet might be. So Jamal, could you off and online again? That might be better, or just plug in or off. That might help you to listen our voice. Headphone, just headphone off and on. Jamal, please off your headphone. Plug in and plug out. Plug off headphone. Elizabeth, could you hear me? Elizabeth, could you hear me? Elizabeth, could you hear me? Elizabeth, could you hear my voice?
Yeah.
All right, all right. For God's sake, now we are a bit safe. Actually, internet creating huge problem today rather
Yes.
than other days. So, my friend Elizabeth, that my friend Mumba's telling regarding medical social work service. Do you find any involvement in your country of the social worker side with the medical hospital, government, because during COVID-19, when the dead body is buried, nobody, no relatives, father, son, daughter, sister, nobody is allowed to come to that buried dead body. Or when they are in hospital, actually, positively, negatively, they are not entitled. They are advised not to go close to them. So, how social worker is doing their job in medical side? Is there any options? If there, then you can discuss. If there is no involvement of medical social worker in Sierra Leone, then you can share us something.
Um, there are some involvement of social workers into the medical aspect in terms of counseling and in terms of working with doctors and nurses to get patients, because we have to say, and because of that, they, but as it is, with the help of social workers, with the help of social workers in the country, there has been lots of people who end up accepting their status because um, when social workers come in, they talk to you, they counsel you, they teach you, they work on your psychology, your psychological being, and people get to accept that they have COVID-19, because some people, even when they do tests on them, it's difficult. And nurses and doctors we have are not too many. So for them to spend a lot of time on one patient to convince you of COVID-19 after a test, that is where the social.
All right. Jamal, Jamal Ahmed, could you hear my voice? Most probably you are hearing me, but we cannot hear you. Yeah, yeah. Bad network everywhere, really. Network is a big issue now because users number is increasing. But so Jamal Ali Ahmed, could you share something from Nigeria? Nigerian situation during COVID, mental health, education, online education. So do you love to share something? Is it possible from your side? Because network's not good today. we cannot hear you. Jamal, we cannot hear you. Elizabeth, could you hear him?
No.
Jamal, none of us could hear you. There is use problem or connection problem maybe. Jamal, no worry, my friend. So next time, obviously we will include you again. We will invite you again to speak, because today we cannot hear you. Actually, this is internet problem. Elizabeth is reporting. Justin, our friend, is reporting everywhere in Bangladesh. Electricity, due to electricity network, Wi-Fi is problem. It's a big issue. Last 2 days, 3 days, and during COVID-19, internet based users number is increasing rapidly in a high number, right? So internet using now a big deal. And I'd like to share you something from our parts from Bangladesh, and for the platforms that actually I have created. I'm personally, I'm an academician of social work. In beside, I love to focus on practice. Joseph and Elizabeth and my friend Jamal and my audience, my friends here, I founded that Community Social Work Practice and Development Foundation, just to highlight, promote, and progress social work practice in different fields, not only to give support people logistically, just support process development, sense development, and ideas development, interaction, reciprocity, communication, so that many of the young scholars can have a platform after a few years at least, and just create a buzz. Every year, my friend Jassim, Jamal, that every year, last few years, over the years, I have been organizing and celebrating World Social Work Day with some seminars, some conferences, some human chain, colorful rally discussions, right? Well, we have been holding that World Social Work Day here. That was not held before 2014. We have been creating the sense, and unluckily, due to COVID-19 this year, our conference, 2 days international conference, and promoting community sustainability and human relations, that was preset and well set to be held on last March 21st and 22nd, but it couldn't be held due to COVID-19 lockdown situation, and we are hoping so end of this year, by December, hopefully possible, we must hold that conference just to keep the sequence every year. And we have a platform, YouTube channel, that is also Community Talks. My YouTube channel is Community Talks. This is a community leaders platform. My sense is, actually my group sense is, everybody is having a sense of social work. Everybody has a sense of social humor, social relationship, compassion, sympathy, empathy. But due to the lack of platform, due to sharing, they cannot be cared of. They cannot care others, actually. So this is the Community Talks YouTube channel, and we have a Facebook page. Facebook page is Community Talks BD. Again, I'm telling, Facebook page is Community Talks BD, means Bangladesh. And there is a Facebook group, just make a global platform, that is Community Social Workers Network, BD. Community Social Workers Network, BD. This is a global platform we have been creating here. I don't know what is the end, but I do believe, start from today. We should start from now. We should start from just now, making any delay, because social work obviously staying behind in most of the countries of the world due to organizational reformation, collectivism, collective efforts. And of course, those social workers are treated to be the best leader, to be the social leader, communicable leader, best manager, but still we have some lackings. I do firmly clarify this. I do firmly mention this because we have some extra busyness with academic efforts rather than in practice field. Social workers, academics, they don't love to, most of the cases, come to the field in practice. I do believe they should come to the practice simultaneously, academic teaching and learning, so that social workers might be 100% fulfilled. Social workers might be in development field. They might have a good space, but in most of the countries, last few days before, I was attending a conference in Singapore, online conference, and Dr. Bashu, Professor Bash, was telling young social workers should be involved in small organizations, entrepreneurship, development, so that they can utilize their compassion, they can utilize their affection and love for the people, because already established organizations, they have a wide extent of job, huge workload, so they cannot come to the people, they cannot come to a doorstep, to very close to the people because of their high volume or high range of work. So social worker in particular should be involved in developing small organizations to provide people mental health support, to provide people other logistics support, academic support, social works training. So my vision is, my friend Mumba, my vision is, my friend Jamal, my vision is actually to create a platform to train people on social works, ethics, beliefs, norms, behavioral patterns, right? And make a connectivity so that people has a good heart, people has a good mind, and people has a good stamina to work for people, other people of the community. Because we do believe without social work intervention, as social worker is a generalist, social work is working on a holistic approach. Social work has a comprehensive sense globally. So if we can come together in irrespective of our boundary, forgetting our boundary, because this is virtual world, we can communicate each other very easily. We can share our knowledge, views, and practice and approach, academics and practice. So our young social worker can be motivated from that platform. So far, I could exchange our training program, our ideas, academic teaching and learnings, working fields we can share. But it's very difficult to visit all the countries. But through this virtual platform, we can easily exchange our trainings each other, so that our friends can, our younger social worker can be motivated, and they can have some extra idea, global idea from that platform. Actually, for that thing, I have taken initiative. You know, this is month of Ramadan in the Muslim world. Ramadan, we are fasting, but as we are stuck and home lockdown situation, I just took initiative to utilize this time properly to make a connectivity and to give some sharing, and through this sharing and caring process, that our foreign friends can be connected. They can share their own country's idea to my country people and our friends, young social worker here. So hopefully Joshim and Elizabeth, Jamal, Ali Ahmed, actually due to internet problem, our date was yesterday. I changed it again today, but still internet is a big issue in my country due to this Amphan cyclone. Already 12 people died due to this Amphan cyclone. It hits coastal belt hugely badly. So situation is not good, and you know, followers number is very poor. Many people just calling me, they cannot be connected, they cannot watch this program. Actually, they love to see our foreign friends, they love to be connected, they love to put comments, but it's very tough for them. So again, we will be meeting together soon after a few days, and I'd like to share you one thing. Next month, it might be 2nd or 3rd June, I'm going to hold an international seminar in collaboration with IASSW and IFSW. So by the position, obviously you will be invited, and Jasim, you will be the part of that because you are representing IFSW African region. Other friends will join, and all global leaders of social work. You and other friends are here, Jamal, Elizabeth, and so many other friends will join on that forum, on that seminar, especially on COVID-19 and social work response, a global debate. That would be the title so far. And I'm in connection with Dr. Rory. He is advising, actually, he is deciding that we can have, in that region, we can have a great initiative for that online platform. So we are very close to end, and I beg pardon to all my audience, friends, and followers. Actually, our session normally extended so long, but due to so many untelling or unseen constraint today in particular, we cannot continue this longer much. And I would like to declare one thing. Tomorrow there is the same session, same time. Professor No Tan Tiong from Singapore, Jamal Josim Elizabeth, you might know him, professor from Social Science University Singapore, and he is current treasurer of IASSW. Professor Mariko Kimura from Japan, she is professor of Women's University of Japan, and she is immediate past president of IFSWAP. She will join tomorrow, and professor and Commonwealth Social Work Association president Tio Watio, she from Malaysia. They will join tomorrow. So hopefully you will be connected tomorrow with us, and we should pray all together to have a good internet connection tomorrow, electricity tomorrow, because it's a really great interruption today. We will come again. Jamal, my friend, I will invite you again soon. You will be connected soon, because today's internet, it's a big issue today, really. And by the grace of Almighty, still we are on. We are supposed to be off by this time. I'm also in crisis of internet and electricity. That's a big deal today. So, Elizabeth, last minute, how could you clarify the essence and the good side of COVID-19? Or for the followers and friends, do you love to say anything? Time is 1 minute. Just a minute, Elizabeth, please. Just go to Anne, and after you, I will come to Jasim. Elizabeth, please. Elizabeth, could you hear me? Elizabeth, could you hear me?
Come back again. Sorry.
All right. Your time is 1 minute just to finish, and just to say something for the viewers, friends, audience, our other friends, and voice from Sierra Leone. Okay.
Hey, to everyone watching this show this morning, it's 5 minutes after 10 in Sierra Leone. That's why I'm saying good morning, good afternoon in Bangladesh and all other places. I am happy to speak to you. I'll keep on talking to you. I want you to know your neighbors, these are difficult times, and also be one another's keeper, but most especially mask up, avoid crowded places, and observe social distancing. And if you want to cough or sneeze, use your sleeve. All right? Don't touch your eyes, your nose, or your mouth. Stay safe, everybody. I love you from Freetown, Sierra Leone, West Africa.
All right, my friend Elizabeth, thanks a lot. I know you are busy, especially this time because of COVID war, right? COVID time, you were very busy with the trainings and the social logistics support with set up your volunteer from your organization. So you have spent this time. I'm grateful to you for your wonderful time and discussion. Thanks again, Elizabeth. I'm coming, dear friends, I'm coming to, there is the last comment from Sharmin Shithi. Good afternoon, sir. Elizabeth and Mumba, I want to go Somalia for visiting, but I heard this place is very dangerous, like robbery and others crime Is it true? Actually, Sharmin, not only in Somalia, Nigeria, Africa, Bangladesh, India, all the countries, there are huge and so many versatile crises, but the world is being changing. World is being changing by the changes of the people's heart, by the changes of the good soul people. So we are a very fantastic question, but if you want to visit, definitely Mumbai, Ali Javed and Jamal, they will invite you to visit that country and they will give you safeguard. No worry for that. They are always with us. No worry, Sharmin. If you love to visit, just communicate with me. Communicate with Elizabeth or my friend Mumba or Jamal or Elizabeth. Anybody you can meet and communicate. They will give you safety and security there. No worry for that. They are by heart social worker. My friend Jamal, really, I'm missing your voice. We are missing your voice. We are unlucky, but we are seeing your nice face. So, my friend, just take our regards on behalf of Elizabeth, Mumbai, and me, and our followers. Hopefully, we will connect you again soon. No worry for that, my friend. And Mumbai, please, could you conclude this by telling something from your side, a few words?
Yeah, thank you so much. And I want to appreciate, I think, the role that social workers in Africa have played in responding to COVID-19. We realize that, yes, we've been talking about physical distancing, but I think looking at our circumstances in Africa, that may be difficult. But under the circumstances, I think we've managed to kind of suppress and contain the spread of COVID-19. And I think COVID-19 has been a wake-up call, I think, for our governments, respective governments. Governments, we are calling upon you, all of the governments in Africa, to invest in health infrastructure and also ensure that we provide clean and safe drinking water to the people. Other than just calling upon them to wash their hands regularly, let's provide the water and ensure that once we are faced with any pandemic in the future, we should be able to, to manage it well. Then also we need to rely on our locally generated solutions as social workers in Africa and ensure that we prescribe locally thought out measures that are, that are applicable to our situation. So for now, I think I'm encouraging all social workers to keep safe, stay home if you can, and ensure that we protect ourselves whilst we protect others. But let's keep social services open to service users. Thank you.
Very good, dear viewers, friends, and honorable speaker. We are very close to end. I'm just going to end this, and before that, I would like to share that the same thing again and again. The quotation of Napoleon Bonaparte: "The world suffers a lot, not because of the violence of the bad people. The world suffers a lot because of the silence of the good people." If you think really you are honest, if we think we are honest, we are hardworking, we are good people, we should raise our voice against all kinds of evil deeds. Otherwise, you can never say, you can never enjoy, you can never find a very good, sound, and healthy community. You have to create this for your survival. Nobody will create for you. Don't think so, because you are the people of the community, you are the resident of the community. You have to work forward. You have to work proactively. Then you can see a better world. You can see a better country. You can see a better community. You can see a better family. Last of all, our title: stay home, stay healthy. Not only safe, try to stay healthy mentally. You have children, you have senior citizens, you have maid servant, you have friends and families out of the city. Just be connected. Just be communicating always with them to keep mentally mental peace, sound mind, and healthy mind. Thanks a lot again. Be with us tomorrow. Watch us tomorrow and be connected. Put more comments. Share this with your more friends so that other friends can be connected. This is purely a social work platform. This is purely a community social platform. By the grace of Almighty Allah, definitely we could succeed one day to make this global world together based on the platform of social work, because social work can do many things. They have a big heart, they have compassion, they have condolence for others, they have sympathy, empathy for others, they have sharing and caring mind. Thank you, everybody. Thank you again. Thanks, my friend. Good noon, good afternoon, good morning from Bangladesh. Thank you. Allah Hafiz.